have first team dental.
Hello everyone, we are Dental and I'm 𝗂𝒏𝒅, currently a practicing dentist and the CEO of Dental. We are a software provider for dental support organization. We already built up the largest dental platform as an e-commerce in Taiwan. We are mainly focused on these 5 major aspects of the dental industry, like patient data or product or education, insurance integration or operation. First of all, for addressing the patient data and operation, we launched our first main product, dental HealthTech. It's the only one cloud-based practice management system in Taiwan for now. And for product, we provide the e-commerce platform for dental clinics. We already integrated more than 150 suppliers in Taiwan, which is the largest and the only one open platform. For education, we provide an online to offline professional dental education platform. And for insurance, we are in the processing of productizing of our AI-assisted software. We aim to provide a service for insurance company. Additional, this is our latest product, just launched in July. It's a generative AI tool for dentists, designed for dentists. As a dentist, we just need to input the finding of the patient, and the system will generate the tooth chart and the treatment plan recommendation with description using the generative AI technology, regardless the user's existing software. This is our user face of the X-ray image management. As a dentist, we often explain the X-ray to the patient, like you. You often remained skeptical or didn't understand what we are talking about, right? Now we can use AI. We can determine the severity of the periodontal disease, whether it's stage 1 to stage 4. For this case, it's stage 2. So you just need the deep loop planning and just keep follow up. It's okay. Okay, in this case, it looks bad. How bad is it? It's stage 3. The bad news is that you need the guided bone regeneration surgery. However, the good news is that insurance company will cover all your expenses for the surgery. So this significantly will increase your willingness to receive our treatment plan suggestion. So we can provide the insurance company the software service throughout the whole process, like the initial application stage or medical service stage, even the final claim stage. So this can ensure the authenticity of the data and the utility AI to access the severity of diseases. So what we have done so far, in Taiwan, we have already more than 18,000 individual users, like dentists or dental students or technicians. It's about half of the market. And for procurement accounts, like dental clinic accounts, we already have more than 1,900 clinic accounts already. It's about 30% of the market. For dental HealthTech, we already have more than 35 paying users in Taiwan and more than 150 global users in 15 different countries. So about our market strategy, we have different product strategy based on the dental market maturity in different countries. For dental HealthTech and dental.ai, as a universal copilot tool for dentists, we can provide service for the user around the world. And in the next 2 years, we will launch our education platform and e-commerce platform in these 6 countries. And we can use our total solution ability to launch a chain clinics in Vietnam and Indonesia. And for the AI system, we were looking for the opportunity to collaborate with the insurance company in advanced countries like Japan and the United States. And TY and Victor is our leader of our R&D team with a PhD in computer science. Our R&D team with more than 30 programmers and designers. And here are our products milestone. We just passed the latest version of cybersecurity ISO last month. And we're going to get approval of TFDA and FDA next year. And we are going to collaborate with the insurance company to launch our AI dental insurance product in 2025. Okay, we are Dental. Thank you for your time.
Thank you, Casper. This is Dental. Any questions for him?
Thank you. Can you elaborate more on your next milestone, like in 2024, regarding to your major performance, what kind of revenue or any kind of client number in 24, 25?
Go ahead.
Okay, the revenue in 2024 will be maybe about 10 million US dollar, and for 2025 might be 20 million US dollar.
What is your major milestone, like traction?
Yeah, will it be the major traction based on the e-commerce or based on the HEAS?
Yes, in 2025 based on the e-commerce platform, because we just start e-commerce platform for dental clinics just these 2 years. So it's very early stage in Taiwan market, because the Taiwan market maybe 300 million in dental material market size.
Sorry, I had a little confused. How do you define your company? Are you an e-commerce company or a software provider? I think if you are a software provider or you are a dental AI company, it's a little different from the e-commerce company.
Yes, there's a different strategy in different area. Like in Taiwan, we are software provider and we run our business in e-commerce in dental area. But in Southeast Asia market, we just only the software provider for a local distributor.
Yeah, I think I would just want to follow on to that. If you're doing the AI and then you're even going to build out your own dental practices and that in different parts of the world, is that a little bit too much to take on? Where is actually your real core IP? Is it with the AI detection?
Yes.
Or is it the software platform? Or is it in the future building out PPOs or dental clinics?
Yes, thank you for your question. So we take our e-commerce platform or education platform like a barrier for us. But the core value is our AI team, like a AI diagnosis system or the AI generative AI for dentists. Because we just launched our patent in July for United States patent and Taiwan patent in this generative AI. Yes.
Because we want to attract more traffic to your platform. So what is your plan to attract more people or users to your platform? That's the first question. And the second one is, what is your R&D percentage expense of your OPEX?
Sorry, the second question.
The R&D, the expense, the cost of R&D of
month?
your OPEX. Because
Per
you will pay a lot of
Yes.
cost in your R&D system or research. Because you want to attract more
Yes,
insurance,
yes.
just like this kind of company. So how to speed up your marketing penetration?
Okay.
You can have 30 seconds to finish that.
Okay, the first answer is that in our opinion, experience, we start from the education. So for doctors or dentists, education always the first traction. Yes, and the second question is, you mean the monthly fee or cost?
The cost of your RD team. You
Yes.
spend a lot on your RD team, so
Yes.
how much is that?
Yes, that 50,000 US dollar per month.
Okay, I guess that's it. Thank you so much, Casper.
Thank you,
This is
thank you
Dental.
everyone.
Next startup, we have Insight Medical Solution.
Hello, everyone. Good afternoon. I am Kevin of Insight Medical Solutions. Today, I will introduce the world's first capsule endoscopy for upper GI tract, including esophagus, stomach, and duodenum. Have you heard your friend had terrible experience in gastroscopy? Of course. So the patient looked like very scared to do the gastroscopy, and the elderly deaths during the anesthesia exceed 35%, and the fat people with the chronic disease is a higher anesthesia death rate. So now, our company, we already developed the world's first wire magnetic assisted capsule endoscope with the narrowband imaging. I will talk about later. And we already have the Taiwan FDA and the CE certificate. And we are looking forward to have the China NMPA license and conduct clinical trial requested by FDA 510K next year. Okay, this is the whole upper GI tract examination by our capsule endoscopy. So first of all, the patient naturally swallow our capsule endoscopy with some of drinking water. And then the physician will operate our magnetic controller to control and move the direction of the capsule endoscopy inside patient's body. It takes 10 to 15 minutes to finish the upper GI tract examination. And then finally, the patient just put it out, single-use capsule endoscopy. So there are three key features I would like to share with you: safety, comfort, and rapport. For the safety, we provide a high accuracy imaging and no anesthesia, no pain during examination, and single use, so no cross infection in hospital will incur. And for the comfort, because anesthesia free, so no need to accompany in for the family. And right after examination, the patient resume normal life. And for the rapport, we provide a real-time imaging. And during the examination, so the patient can easily consult with the doctor. So this is, we did a lot of clinical trial, either in Taiwan or China hospital. This is the clinical values found by the doctor. So the doctor always asks, can they have the quick scan tours and regularly let Warren scare the patient. And they would like to early diagnostics for the esophagus diseases such as 𝒂𝒏𝒅𝒄 and 𝗏 for the white light imaging. So this is a white light imaging and this is narrowband imaging. But for the narrowband imaging, will be affected by the doctor's personal experience. So now, our company developed the world's first wire magnetic capsule endoscopy with narrowband imaging. So this is our AI-assisted diagnosis system. So during the examination, the AI diagnosis system can help and assist the doctor diagnosis the location of the disease symptoms. And this is esophagus distribution map. You can see more than 21,000 new patients in USA and more than 480,000 new patients in China. So the early diagnostic market is very huge. If 70 million population, total population in China, and with the pulse 10% of land, and then the economic benefit will be $1.4 billion per year. And our goal will raise $60 million before listing in China and US market, and 50% from our mother company, 𝒂𝒏𝒅𝒄 Technology. And we are looking forward to have IPO, to go into the IPO market in 5 years. And we are Inside Medical Solutions. Thank you for your time.
Thank you so much. Gastroscopy is my biggest nightmare when checking my body condition. Anybody agree with me? So do you have any questions for this team? Let's go to 𝗠𝗲𝒂𝒏𝒅𝒄 first then.
A very simple question. How about your FDA process and schedule?
Oh, okay. I just mentioned in the presentation file, next year we will conduct clinical trial requested by FDA 510K in Taiwan hospital. And next year we will have the China NMPA license. because right now we are going to do the clinical trials in China hospital now.
Thank you for your presentation. First of all, use capsules to do this kind of exam, I believe it already exists for quite a while.
Yes.
Why can it be more popular since it's so, unscared, or less scared for the patient?
Yeah.
And why you think you are doing better than the traditional capsule kind of exam?
Yeah.
Thank you.
Okay, thank you. Because we provide the more comfortable and no anesthesia, no painful for the patient. So you will be help the patient to do the upper GI tract examination every year.
So less pain, more comfortable, more convenient. And why is that?
Sorry, is your solution is really faster, quicker than current conventional one? Do about this kind.
For the examination time?
Yep.
For the gastroscopy, similar, because gastroscopy in Taiwan hospital, it takes 3 to 5 minutes. Yeah, but the cost, examination expense is very low. Okay, and for us, we take 10 to 15 minutes. And for the esophagus examination, we take 2 minutes, can finish.
Okay, Jason?
Maybe you downsize the gastroscopy, but what about the doctors need to, when we do traditional examination, the doctor can see if you have some polyps, you can directly cut the polyp. So the doctor may still need other equipment to go into our body. So even you downsize the gastroscopy, but we still need other devices to get into that. So for the total solution, can we become more comfortable?
Yeah. Because capsule endoscopy only can do the diagnosis, okay? So no biopsy. But the market trend in medical device will be early diagnosis and early treatment. So hope it can help. I answer your question. Yeah. So remember, you go back to your home and tell your family they can do the more comfortable capsule gastroscopy. Okay. Thank you.
Okay, thank you so much. Our final team in Med and Health is SiriuXense. Welcome. Okay, let's go.
Hi, I'm Julia, product designer in Uniwell. How many of you are parents? What was your first 2 years like when your child was born? Is it frustrated or is it like hell? Uniwell is here to help parents from hell to heavenly paradise. According to Snooze survey, that 7 out of 10 parents, they lose at least 3 hours sleep a night, and it adds up to a shocking 133 nights of sleep before baby's first birthday. So before baby can communicate with their parents, it's really hard for parents to understand their baby. So it takes a really long time for them to understand. So how do parents know their baby? From medical personnel for short-term care or experienced babysitter, which are very expensive, and also some parents will get baby monitor to monitor their baby. So these are the common monitors in the market right now: audio monitor, video monitor, movement, oximeter, and heart and breathing monitor. However, we have discovered that most of the monitors they actually emphasize on the safety, baby safety, and also parents' pleasure and achievement, but not so much is emphasized on the precarious solution for physical needs. But this is quite important for parents because they have to take care of their baby's physical need every day. And it is also, if you parents don't take care of their baby physical need well enough, then baby will cry like little devil. So Uniwell, we believe that not only the baby safety is really important, but also the physical need is very important. Then it will really give parents the pleasure and also achievement. According to Model Intelligence, that they believe the key factor driving the demand for baby monitor is fueled by the increasing number of the nuclear families and working parents worldwide. And they estimated until 2028, it will reach to 2.32 billion for the global baby monitor market. Our technology is bioacoustic technology. And we sense human body, we sense baby's body, voice, the sound of their body, and then we combine it with our own algorithm to monitor baby's health. So for example, we can monitor different situations like the digestion frequency and also high abdominal temperature or the breathing noises from allergy. So if parents can know this situation ahead, they are more likely to prevent baby from getting the situation more serious. And also we monitor baby's sleep stage. We will notify the parents when their baby is gonna awake soon. And for example, we awake them through, we give the notification when baby is at the light to REM stage. So parents are allowed to turn on the light or lullaby to soothing the baby. Or even more, we give the poop notification for parents. So parents can change the diaper immediately and then avoid the diaper rush. So here, Uniwell, we offer all-in-one service for baby's health care. We cover safety and also physical need and care. And lastly, most importantly, we give parents pleasure and achievement. And here is our milestone and business partner. In this year, we partner with Postpartum Care Center and also a hospital to validate our product market fit. And then next year, we will emphasize on e-commerce channel in Taiwan and also the US. And then in 2025, we will aim for as being a data service provider. And thank you everyone for listening. And together, we make parenting like a paradise.
Okay, thank you, SiriuXense. Please stand in the middle of the stage. Their product is Uniwell. Okay.
We've invested some related portfolio before. So I want to ask, would you consider your product as a medical device, healthcare related product, or a baby gift?
We currently not a medical device yet, but we collaborate with the Postpartum and also center and also the medical hospital service, so to validate our product. And so first, I think we will focus on as a baby gift first, and then also we will aim for the high-end customer, high-end user first for our market plan.
Any other questions? Hey, Volker.
Are there any R&D breakthroughs, like in comparison to your competitors? Anything you're working on that's going to be super exciting, or where you already differentiate tremendously from a technology perspective? Not really patents, more like actual real impact and results.
Oh, you mean for?
You have a lot of features. Is there anything that's putting you an advantage, being in Taiwan, having all these resources here, versus a lot of competitors around the world, or?
Yeah, most of our collaboration partner is Postpartum Care Center. And then our competitor right now, we currently don't have competitor that with a baby monitor because we are all-in-one service, and not right now in the market. There's no all-in-one service monitor in the market. Yeah.
If a startup says there's no competitor, that's usually scary. So why is nobody else doing this then? Is your product not optimized for all the things you're doing? Can you be all things for all people?
For all the things for
Sorry, that was just a phrase. Can you then be delivering the quality for all things you're doing? Why don't you have competitors? you don't have competitors. Why?
Currently, most of the baby devices they only have one aspect. So we want to.
But why? Why is nobody else able to do that?
Because it's more complicated, and they don't have the pattern for it right now. So that's the main reason. Yeah.
Darren, you want to?
Yes. Hello. I'm glad that you're doing this. You know, because I have kids, right? You know, it's really hell, right? I mean, Volker heard me say hell as well. So apart from all the features like heart rate, temperature and all this thing, I think what Volker's asking, I mean, is there any other functions in the future? Like you could do predictive stuff, maybe the baby might have a cold, but it hasn't developed symptoms like a cough or whatever, right? Or maybe it has a rash that is coming up or something like that. Could you do predictive anything? Because to me right now you're just a consolidation of all the notifications, right? I mean, you say competitors like what, baby monitor, motion monitor, whatever, right? It's all there, but you're just putting everything into one device, right? Is there more to just notification?
Yeah, we will collaborate with baby supplement supplier, and we want to do the precise marketing for different symptoms and give the parents corresponding baby supplements or supplies.
And you mentioned you're working with the 月子中心, right?
Yes.
Right. I'm looking at your website, right? It costs about almost 8,000 Taiwan for one device.
Yeah.
I mean, what's your model right now? Are you doing B2B to
yes,
C?
currently it's B2B to C. Yes.
Okay, thank you, Darren. Our time's up. Thank you so much.